We're good to start, ma'am.
Hello and welcome in today's nursing webinar session. Myself Shanti, and we are going to talk about the very emergency management of poisoning and as a nurse what we are supposed to understand at the emergency setup. Having said so, we have Dr. Malay. Are you there? We have Dr. Malay Mishra ji, who is our HOD Emergency Medicine, Yashoda Hospitals, Secunderabad. And as a speaker, we have Miss Annapurna, who is our Senior Nurse Manager, and she looks after the emergency and medical surgical ward. I welcome you both. Okay, so you can just go for the second slide. I can keep discussing unless Dr. Malay joins, then we will again, get back. Yes.
Good afternoon, all. Myself, Annapurna. Let us discuss about poisoning. What is poisoning?
Yeah.
Is any substances that is harmful to the body causes injury, harm, or death?
Yes. Yeah, Dr. Malay, are you there? Okay, you can go for the second slide also unless Sir joins. Yeah.
Types of common poisoning. Paraquat poisoning, organophosphorus, rat poisoning, corrosive and chemical poisoning, floor disinfections, and vasomold, hair dye like drug overdose, benzodiazepam, beta blockers. We get to see in emergencies regularly.
So which one you get to see, Annapurna? You see the paracetamol dosage or, Alprax or sedations or beta or calcium blockers, or sometimes, diabetic medication also patient consumes self-intentionally and come. Which one you get to see commonly?
Paracetamol. Most of the patients in paracetamol overdose.
Okay. Teeth, meanwhile, if you can check with Dr. Malay, we'll just continue with this
Yes, ma'am.
session.
He's trying to connect again.
Yes, yes. So, yes, Annapurna, that was a very valid thing. And this is how you get to see, yes. And yeah, you can carry forward, go forward, yes. Yeah, go for the next slide. Yeah.
Let us discuss about route of exposure. Ingestion, nothing but swallowing, bleach, pesticide. Inhalation, example, ammonia and chlorine gas. Skin contact, scorpio stings, and snake bites. We used to get villages most of the cases.
Patient, yes. So, in very recent time, did you or have you all received any snake bite or skin contact poisonings? Any recent week or in the month or previous month?
Yes, ma'am. Yes, we have one patient, ma'am. I'll get you.
Okay, was it a snake bite or scorpion bite?
Snake bite, ma'am.
Okay, so did the patient recover and went well?
Yes, ma'am. Yes, yeah. He went treatment and went home, ma'am.
Okay, yeah. Continue with carry forward. Yes, go forward.
Let us discuss signs and symptoms of poisoning. Symptoms may include nausea, vomiting, abdominal pain, dyspnea, irregular heartbeat, dizziness, confusion, seizures, muscle weakness.
Okay, so we have Dr. Malay who has joined. Mishra sir, can you unmute yourself?
Yeah, I can hear you.
Yes. And Annapurna, go back to the first slide, which is poison slide. Yes, the definition of, yes, here. Yeah, you can go for the first slide. First slide, Paraquat. Sir, yes, welcome you, sir. We welcome you for this session. And
thank you. Sorry for the technical glitch.
Understanding, yes, thank you, sir. And understanding about the poisoning is little, not very much known to the, medical surgical ward nurses, because emergency and ICU, yes, because emergency treats and then the ICU nurses, they manage the patient. So my first insight we would like to understand from you is paraquat poisoning a widespread global issue? Because it is again, the people use for their self intentionally and deliberate intention of suicide and etc. So what is your insight about this in short?
Yeah, basically, Paraquat is a very real, challenging aspects of poisoning care because
Yes.
compared to the developing countries like India, Pakistan, Nepal, and Bhutan, the rising cases of Paraquat poisoning is very, very high. Why? Because this paraquat poisoning is having the LD50. That level is very, very high. Even a 10 ml of consumption of paraquat or diquat can
Yes.
ultimately the patient can be able to uh, some like the organ damage will be happening, like major organs, kidney, then liver, lungs. So it will be
Yes.
difficult for us in a clinical basis to deal with these patients in a regular basis. So paraquat is really the mortality rate is very high. Almost you can say almost 90% of rate mortality is there in the paraquat. So it is a very challenging job to treat in routine practices.
Yes. So, Annapurna, we have already discussed until the 4 slides, but you can share the second slide and we will have this insight from Sir. Sir, again, second one, like as we are also discussing about the definition of poison. Now, how does this toxicity of a poison affect the body? Like, as you said, the chemical or the
So
composition
this
of, yes,
yes. So this starts from the cellular level. Once the person had consumed some kind of poison, okay. So it starts from the cellular level. There will be lack of oxygen. Okay, the cell will be having necrosed gradually, and it will have some kind of symptoms like in terms of airway. There will be having difficulty in
yes,
swallowing. There will be laryngeal edema. Okay, there will
yes,
be heavy secretions. So we need to take care of ABC management. What we do in a routine basis, airway, breathing, circulations. There will be several kind of symptoms will be there. Like patient will be having bradycardia or tachycardia. The heart rate will be very high or very low. The respiratory rate will be very high or very low. Sometimes the person will be sweating a lot. There will be profuse sweating. There will be very high temperatures. And many other times patient will be having hypothermia, like less than normal body temperatures. There will be having like pupillary reactions like sometimes it will be having mydriasis or meiosis kind of picture. There will be retention of urine. There will be heavy gastrointestinal symptoms. Patient will be having decreased bowel sounds or sometimes
yes,
overactive bowel sounds. So that depends upon head to toe because some if some person has consumed poison, that spectrum is very very wide. So it is not a particular one system is being involved. There will be several systems. It will be involved simultaneously. So we
yes.
need to take proper care and we need to practice this ABCD management of poisoning.
Yes. And as you rightly said, it targets all the organs in the body.
Major
Yes.
organs of your body.
Yes. Yes. Yeah. So you can keep sharing. Yes. Third slide, Annapurna. Yeah. You can just keep sharing, no problem. And third, as we were discussing about the different types of poisoning, like paraquat, OP, rat poisoning, corrosive, and also the drug overdosage. Sometimes we get to see patients medication which is prescribed, maybe their parents or relatives that also been consumed. So, which type of poisoning is most common? As we are talking, like paraquat is common, and which one has the highest mortality, or maybe the severity is depending on the amount of consumed poison. Yes, sir.
Yeah. So in this part of India, this particularly the south region, people there are so many chances they will get exposed to organophosphorus compound because many majority of them are in farming land. So the exposure of organophosphorus, organochlorine is very very high compared to the northern part of India. Northern part there is sulfurs, that's aluminum phosphide. It is very very high, and in particularly in the south region, people used to take all these pesticides very often. And coming to the mortality part, yes, of course, paraquat being the most common uh, mm, um, poison to treat, and the mortality is very high. After that, these corrosives and chemical poisonings will be the second line. And sometimes, major the times, what we see in our day-to-day practice is small children. They are exposed to some detergent or
Mm,
disinfectant kept in the
yes,
home, so they are very much prone to get affected because for children everything they what they will see they want to taste it.
they want to drink
So
and
that
taste.
is also the challenging part is, and majority of the times persons will be using new hair dye that's small.
Yes,
So that will have some kind of anaphylactic reaction, some allergic reaction. So we need to take care of airway very early. If you fail to diagnose vascular poisoning, we cannot survive the patient, because once that laryngeal edema, that stridor happens, so it will be very, very difficult to intubate the patient. And in our daily practice, we may often see drug overdose cases like paracetamol, which is very, very easily available over-the-counter medications,
Yes.
benzodiazepines, particularly alprazolam, clonazepam, because people right now these days, they are taking these medicines on a very regular basis, and beta blockers, calcium channel blockers. So we see not that much of variety of drug overdose cases, but yes, of course, there are chances. So we need to detect by looking at the initial signs and symptoms. We do certain kind
Yes.
of taste that we will be subsequently will be discussing in the slides.
Yeah.
But the majority of that time, we need to obtain an ECG. By looking at the ECG level, ECG recordings, we can manage these cases.
So over to you, Annapurna, for the rest of the session. You can just share the slides as per the instruction, and we will just discuss further. Yes.
Yes, ma'am. Yes, ma'am. Let us discuss about signs and symptoms of poisoning, ma'am. Symptoms may include nausea, vomiting, abdominal pain, dyspnea, irregular heartbeat, dizziness, confusion, seizures, muscle weakness.
So you can go back to the fourth slide here, sir. We would like to understand the routes of exposure. Are these the route of exposure, and what is the current, I mean, maybe is there any trends where the patient should approach to the tertiary care centers within few tat of time, or in case of snake bite, will that, the trend of the olden days where they used to, tie above the bite area is still, it is the current trend which is going on, sir. We would like to understand.
Okay, so coming to this route of exposure part, ingestion being the most common source of like a route of exposure. Okay, and apart from that, there are certain poisons which can be like example ammonia or chlorine or phosphine gas that can be released in the air, and if someone is inhaled to that amount of gases, they will be intoxicated very frequently. And some dermal exposures, like example of organophosphorus or organochlorine. The skin dermal exposure is very, very high, because person might not be knowing when they use these pesticides for farming land, and that will slowly absorb into the skin. So the best method is that comes under decontamination part. So once we receive the patient in emergency room,
Yes.
first of all, we need to take care of airway, breathing, circulation, as well as we need to decontaminate thoroughly. There should be a separate room for decontaminations of the individuals. We take care of take out of all the clothes. Okay. And if possible, we should shower that individual for around 5 to 10 minutes, so that whatever the skin is exposed to that amount of poison, it will be eliminated easily. And coming to the snake bite and scorpion sting, the myth is like everyone knows snake bite is once the snake has bitten some part of limb, be it lower limb or upper limb. Normal thought is like that venous will spread by the venous supply, but it is wrong. Actually, the venous supplies by the lymphatics. It doesn't spread by the venous blood supply. So there is no point of tying a tonic weight around the limb or that part has whatever the snake has bitten. So only the mnemonics part you should remember is that's called do it right. So R stands for like reassurance. We need to counsel the patient, like measure the time the snake will have a false bite and it will be non-venomous snake. So, and second thing is immobilizations. So immediately whatever the part has already bitten by the snake, that has to be taken care as a broken limbs. Then immediately the patient reaches to the hospital. And last, that is GH, and T is talk to the doctor. Talk to the doctor, whoever is taking care of you. You explain whatever the symptoms you have. Suppose there will be diplopia, or there will be some bruises around the um, snake, like snake bite part, or there will be some kind of discoloration. So you should discuss everything in the doctors. So what all things you should not be doing is like there should not be any tourniquet application should be there around the bitten part. Okay, there should not be any sucking or licking of that wound, because already whatever the snake has bitten, that part locally it will be having some kind of venom deposited in the skin. So you should not be doing any heroic things. Okay, that we used to see in the movies. That is absolutely wrong. Okay, the major thing is taken care of that part, whatever the snake has bitten, it should be taken as a broken limbs, a broken part. That person, that limb has to be immobilized, and that person needs to be reached to the hospital as early as possible so that better treatment can be provided.
So, sir, you were mentioning some very good mnemonics. Can you please repeat this?
That is do it right. So what are the things to be doing? Do.
Yes.
R stands for reassurance. I stands for immobilization. GES means reaching to the hospital nearest as early as possible. The last T stands for talk to the doctor.
Yes.
Do it right.
Yes. Thank you, sir, for the beautiful update on this. Yeah. Yes, back to back, you can share. Annapurna.
Yes, ma'am.
Yeah, we did this. We did. Yes, sir. When we are going about this signs and symptoms, we could also see few patients also will, throw this seizures. I think, yes. So, what is, seizure? Like, sir, seizure is common because is it because of the poisoning induced condition, which is the developed by patient, or it is for the,
Yeah.
is it for the
Not,
temporary period?
yeah. Not only seizures. Like once the patient has consumed some kind of poisons, so there will be various aspects in our bodily functions like so you will be having, there will be increase in heart rate, there will be non-dilated pupils, there will
Yes.
be diaphoresis. So all these things will be happening. There will be abdominal pain, there will be dizziness, confusion sometimes, and many of the cases it has been shown, like suppose someone has consumed sympathomimetics drugs like cocaine and amphetamines or MMDA, the drugs kind of drugs. So, and you will have some kind of seizure-like activities, abnormal body movements. Many of the times it will be having some kind of body weakness also,
Yes.
mental fatigue. Patient will be in altered sensorium. So once the patient is in altered sensorium and the history says like they have consumed some kind of poison, the first and foremost thing is we need to take care of airway. If the airway is not taken care, then you might lose the patient. So
Yes.
our emergency treatment, there's a basic principle here is whatever the cases, we should always stick to our ABCD approach. A stands for airway, B stands for breathing and ventilations, C stands for circulations. We need to take care of the blood pressures and heart rate as well as respiratory rate also. And D stands for disability. We need to expose the body completely, looking for the GCS level, looking for the sugar level. Like we need to expose and we need to remove all the clothes patient is wearing. Then we can evaluate further, and certain tests we should do to examine in a periodical way.
Yes.
Initial management at TR. Initial assessment, vital signs, heart rate, BP, respiration, and the nature of exposure. Stabilization is very, very important. Securing the airway, providing oxygen, administrating IV fluids to maintain BP, hypo and hypertension, and hydration with IV fluids. Close observation, detect any deterioration or complications. Treatment depending on the type of poison, antidotes. The first 24 hours are the very, very crucial for stabilize the patient.
So,
Yeah.
sir, when we
Here,
receive such a poisoning and this golden period is very important. What
yes,
else? These are only few points, as you were very right in mentioning that ABCD to be taken care, as well as the hypotension and IV fluids. What else
yes.
needs to be monitored as a nursing, bedside nurses? What else they should be careful about?
Yeah. So this is a very, very crucial thing and a very important aspect you have asked. So once the patient has presented to emergency, we should always ask about the caregivers or the attendant, whoever is the patient, at what time the patient has consumed the poison. The
Yes.
time is very, very crucial. Why? Because if the patient presentation is within 1 hour of ingestion, we should go for a gastric lavage. Okay,
Yes.
that is decontaminations by putting a rice tube, and whatever the content is there in the stomach, we need to remove it first. Then we'll wash with the normal saline. That is the first thing. If the presentation is more than 1 hour, okay, we should not encourage going for gastric lavage in one instance. Suppose the person has consumed more than one drugs or more than one poison, there is multi drugs involvement, or there is various, like suppose the person has consumed 2 3 poisons altogether. Okay,
Yes.
so in those cases, particularly, we may go for a gastric lavage or large bowel, irrigations, some kind of. But as you have already mentioned, whatever be the case, we need to stick to our ABCD protocols, airway, breathing, and circulations. We need to look for the urinary output, like we need to put a Foley catheter looking for the urine output, and we do certain tests like ABG, look for the initial lactate level, the acidosis part, whatever
Yes.
it is there. Huh? Then basically, depending upon the conditions, we can treat. But major of the times, the person, whatever the poison he has consumed, there is no antidote available. But the universal antidote, that is called activated charcoal.
Charcoal, yes.
After doing the gastric lavage, we can go for a activated charcoal that stands for a universal antidote.
Yes.
Okay. So in the subsequent slides, we'll be discussing much about on
Yes.
that.
So we also, as we discussed earlier, we would also like to see one evidence-based case scenario, which was treated at your setup. And here we would like to tell the viewers, what kind of poison was consumed, and, what was the, fatality of the patient's condition, and patient recovered and left. So that's how, Annapurna, you can share and you can discuss about the next case presentation. Yes.
Yes, ma'am. Let us see the one of the evidence-based case scenario, ma'am. A 38 years old male patient presented with the history of consumption of Paraquat 100 ml at around 1:30 p.m., followed by 4 episodes of vomiting. Activated charcoal gastric lavage was done in view of anuria, elevated creatine and LFT bilirubin, charcoal hemoperfusion followed by CRRT. Day 1 happened, ma'am.
Yeah.
Fever spikes, tachypnea, resolved slowly. Patient had coagulopathy, 5 episodes of melena hemoptysis due to the endoscopy sigmoid advised, revealed report extensive mucosal injury. For feeding gynostomy, feeding started on TPN, patient recovered slowly, ma'am.
So, sir, here it was, this is one of the very interesting case study, and
Yes.
this is little bit of, little draft which we have taken of the information. Otherwise, when we were just going through, it was a long, case study. And here,
Understand.
the role of hemoperfusion, sir, maybe as a nursing viewers and the students, they do
Yeah.
not know what is hemoperfusion in treating such patients. So, what is hemoperfusion? Charcoal hemoperfusion, sir. Yes, we would like to understand.
So
And
basically, this charcoal hemoperfusion is like there is a compound which can detect the amount of the person has consumed that can easily absorb.
yes,
And basically, there are compounds like high lipophilic or protein-bound compounds.
yes.
Okay, that will not be absorbed through the routine conventional hemodialysis method. So we use certain kind of filter that is called charcoal hemoperfusion that will absorb the amount of the compound whatever the person has consumed. Like be in this case, it's a paraquat. Okay, then the person has consumed more than 100 ml. Okay, and already the patient, when he was presented to our emergency room, he was having anuria, like there is no urine output, and there was a elevated creatinine and LFT. He was having a bilirubin of what I can remember is around 10. Okay, so we immediately started charcoal hemoperfusion in our like emergency room, and subsequently the patient went into ICUs. They have started the CRRT. Okay, gradually in day 2 or day 3, whatever the reactionary counts were high, so fever was there. It has come down after giving up antibiotics and 4 or 5 episodes of hemoperfusion, charcoal hemoperfusions. But unfortunately, he had developed coagulopathies, bleeding tendencies started. He was having severe 5 to 10 episodes of melena, and he was planned for endoscopy and sigmoidoscopy. That revealed extensive mucosal injury, because, as I said, paraquat is a very,
It is.
very dreaded complications when the person has consumed. So, like there will be all major organs like kidney, your liver, your lungs, everything will be affected.
So
So,
these
right, still
filters,
the patient is, yeah, please tell me.
yeah. So these filters are different from the dialysis filters.
Yes, these filters are preferably made, designed in such a way that they will absorb the compound, whatever the person
Compound,
has
which is
consumed.
mixed in
This
the,
is basically charcoal hemoperfusion. This is a super added, no, you can say the newly advanced filter, whatever is
yes,
available these
yes.
days. And it is better than the conventional method of hemodialysis.
Yes, yes. So this is very great to understand. That's how I think we all should raise a lot of awareness about one disease condition. Otherwise, if we don't raise the webinar or we don't talk, maybe
Exactly.
we do not know this protocol also exists. Rather than the doctors, as a nurses, we should know. Yes, thank you. Yeah, next.
Moreover, I would like to highlight certain things here. The time is very, very crucial, and the
Yes,
amount of quantity of poison thing, it is very, very essential. Suppose if it could have been case of less than 10 ml or 5 ml, or the ingestion or time and arrival to the hospital should be less than 1 hour, you can say, then the
1 hour. Yeah.
productivity of mortality and morbidity will be very good. If the person has consumed more than 10 to 20 ml of Paraquat, and the arrival to the hospital is more than 2 hours or 3 hours, then chances of survival is not that much
It's
good.
becomes very tough. Yeah.
So here the basic key factor is arrival to the receiving hospital and the amount of ingestion.
Yes. So, sir, again, one thing out of curiosity, I wish to ask, if the attenders or the patient is accompanied by attender, of course, we do MLC and all. So, are they able to demonstrate and explain what kind of poisoning they have consumed, or they just go clueless, or just because we find some residual volume and we try to find out, or sometimes we go very clueless and it becomes a very treating challenges to us
Yeah.
to treat the
So
patient.
that's a very, very challenging part, what you have correctly raised this point. Many of the times what we face is in our daily practice, the attenders or the caregivers or the friends, relatives, whoever will be accompanied by the patient, they will not tell the truth. Many of
Yes,
the times they will tell the lie. Even
yes.
they will not say the person has consumed poison. So it's our duty to go for a routine evaluations, looking for the initial set of symptoms and signs. We start treating the patient, and because of several factors, because of social factors, because of some personal factors, because of some personal like professional factors also, person
Yes,
will be depressed, and a depressed person cannot be tell the truth.
truth,
So
yes.
it is very, very difficult for us to retrieve the exact history, because history, taking history is a very, very important factor. And we should do, suppose the person has consumed poison and he has presented to emergency in within 1 hour of time. So that means there are so many things we can do it in an early basis. We can
Yes.
prevent further damaging of the organs. If the presentation is very delayed, like after 3 hours or 6 hours, then already it will be difficult for us to treat and to save the organs, whatever it has been exposed to that poison.
Yeah. So let us also discuss about the nurse's role in rapid assessment of patient at emergency setup. Yes, Annapurna.
Yeah. Assess ABC, airway, breathing, circulation, monitor vitals, assisting decontamination, insert IV cannula 18 gauge, gastric lavage, nothing but have to put rails to insert the infusion of NS, and what they consumption have to keep down within 1 hour strictly. Contraindication in acids and corrosives. IV fluids, administrator, antacids, antibiotics. Instill activated charcoal 1 gram per kg per body weight post lavage through Riles tube. Catheterization should be done. ABG to rule out lactate levels and correct S doses.
So having so many interventions which nurses should be monitoring and doing, and apart from this, as you were rightly mentioning, the universal antidote, which is activated charcoal, in which poisonings we use, sir, and are there any delayed or long-term side effects which a patient should follow on? I think the dysphagia, mouth ulcers, mouth injury, which is very common. Also, we
Yeah.
would like to
So
understand.
you have already exactly pointed out there are certain see why it is called as universal antidotes, because it can cater to maximum of the poisons. But
Yes,
there are certain poisons where we cannot give activated charcoal, like
yes.
for heavy metals. Okay,
Okay, sir.
for for acids and corrosives, we should not use charcoal. And gastric lavage also, because gastric lavage has certain limitations. So before doing gastric lavage, we always should emphasize the person's airway should be protected. If there is a altered sensorium patient and the disease is borderline, and you are going to put a tube. Already the patient is already in distress. He has consumed some kind of poison. He is always in this distress phase. And again, on top of that, you are putting a Riles tube without explaining, or that's a very torturous thing. So these current practices these days, they are not encouraging to go for a gastric lavage.
Yes.
Yes, of course. But if there are multiple things are involved, so we may go for a gastric lavage. But the timeline should be done within 1 hour of injections. Second thing, the side effects of gastric, like the charcoal, what you asked, many of the times you will be having constipations. Okay, so charcoal basically absorbs up to the 60% of the toxic substances. And if the lavage is done delayed, or charcoal will have not role, because like if the person has consumed the poison 2 hours or 3 hours ago, even we will do a gastric lavage and put some charcoal into it. So there will be already whatever the person has consumed the poison, it is already being absorbed. So there will be
Yes. So there's a little stock difference there. I think there is some technical error. Yes, as Dr. Mishra was rightly talking about the use of activated charcoal as a universal antidote for the poisoning, and few contraindications like chemical and corrosive poisoning we are not supposed to use. As you can look at the diagram, charcoal absorbs 60% of the toxic substance. Yes, go for the next slide. And to the viewers, I would like to also tell you not to induce emesis or vomiting in case of chemical poisoning. Yes.
Role of petropin, antidote for organophosphate poisoning and symptomatic bradycardia. Also reduces the symptoms of excessive salivation, sweating, bradycardia, convulsions.
Okay, so Annapurna, maybe you all give the atropine in case of this organophosphorus poisoning, because pupillary constriction is one more challenge, and excessive salivation, sweating, bradycardia, even defecation also we prevent, right?
Yes,
And
ma'am.
symptomatic bradycardia also to be monitored by you. As you can go for the slides back to back, you can talk. Yes.
Nurses should observe escalate parameters to observe. Altered sensorium, Glasgow Coma Scale, especially people size. Minimum 2 mm should be there. In initial time, 6 mm will be constricted. Then normally it will come 1 to 2 is normal. Excessive sweating, salivation, hyper and hypotension has to manage. Tachypnea, tachycardia, hypoxia and bradycardia.
So, sir, unmute yourself, and here, unmute yourself, sir. Yeah. Now, this is a very important slide. I think this is a very important slide. I think emergency nurses, even the ICU nurses, they should observe and escalate, monitor few things, and what they should be escalating to the doctor sometimes. Yeah, when the doctor is
yes.
engaged with other patient. So, sir, any other point you want the nurses to be very adhered to? Sometimes they just skip. Maybe they do not know the severity of escalation and observations. What is your view on this?
As you have correctly mentioned, the altered sensorium part need to be addressed.
Yes.
All the emergency nursing staff should be able to tell exactly the GCS scoring, how it is, and they should always go for a pupillary size reactions checking.
Yes.
Like if in many of the poisons, it will be pinpoint pupil or it will be dilated pupils. So they should be able to tell what is the exact pupillary size. Certain poisons like organophosphorus, they will be having symptoms of sludge like salivation. There will be excessive
Yes.
salivations, there will be sweating, there will be lacrimations, okay, there will be urinations.
Yes.
So these are all like toxidromes kind of effects. So I'm not going to that detail, but certain poisons have certain kind of effects on our body. There will be increase in temperatures, there will be increase in heart rate, there will be respiratory pattern, there will be like bradycardia or tachycardia, there will be shallow respiratory breathing or rapid things. So all these things should be addressed by a nursing level. And apart from that, don't forget to check the sugar, because many of the
Sugar,
times
yes.
sugar will be very low, and we are thinking like it could be a poison, but actually it could be a hypoglycemic event. Patient will look like there will be stroke mimics. The patient will be having some kind of abnormal body movements because of lack of like low
Glucose.
level of blood sugar.
Yes.
So that one point we need to address. And always make sure whenever there is a patient in our emergency, we should always go for a doing 5G. That is, first G stands for ABG. We should always go for a ABG level, ABG test. Second is CBG, capillary blood grouping. Always make a note of it, checking the blood sugar level. Third is ECG. Always that's make a habit of doing a ECG for every patient when they do emergency. Fourth is being a pregnant patient, so being a female, we assume that during the reproductive age group, there will be some kind of domestic challenges in the house. So always go for a UPD test to check for the beta HCG whether the patient is pregnant or not. And to confirm that, we always go for a USG ultrasound. So I'm repeating everything once again. 5G to be done in emergency setting. First is ABG, arterial blood gas analysis. Second is CBG, capillary blood grouping. Third is ECG, electrocardiogram. Fourth is USG, ultrasonograph. And fifth one is beta HCG by doing a UPD test. So this 5G should be must for every poison patients presented to your emergency room.
So, beta HCG is for the lady who is confined.
Lady patients during the age group of 15 to 49 years, unless otherwise proved, we should always go for a UPD test just to confirm the patient is pregnant or not. If the patient is found to be pregnant, then the whole entire treatment plan will be changed.
Yes.
So that is what our main challenge is, because many of the times we may face this kind of problems on a daily basis. We are not aware about the pregnancy status. We'll start treating in a normal way, but it will be difficult if the patient is found to be pregnant. So the entire things will be different in a pregnant female.
So it was very interestingly, you have said 5G and even, yes, very great. And Annapurna, can you just, tell your emergency nurses also? So
Yes,
that you can just type and keep it somewhere so that they are, aware of this. Yeah.
sure, ma'am.
So we have come to the precaution you would like to tell, and then we end the session. Yes.
Yes, ma'am. Precaution steps: store medicines and chemicals with labels, dispose of expired or unused medications, install safety locks and cabinets drawer. Person with suicidal tendency should be closely monitored and provide with counseling therapy, ma'am.
I think these are the precaution steps, sir, for the children and for the adult, and the one who is having this, mental suicidal tendency. I think
Yes.
we also agree with this
And
precautionary steps.
one more point I would like to highlight, that you should always there should not be the children should be out of this kind of medication. Suppose you have kept some medications, that should not be outreach of the children's nearby in the house.
Yes.
And second thing, don't mix up the bottles. Suppose many of the times what we see, the nail polish remover, the all out compound, and it will be scattered everywhere. So the teenagers or the small children age group, they will found it very very interesting. They will try, they will put everything into the mouth. Even the naphthalene balls that can be mimic as some kind of
Okay, you can share the second slide, and we have come to the end. Yeah, there's some technical issues. Yeah. Okay, conclusion, we have come to the end. Poisoning is a serious medical emergency, and as sir and we all were discussing rightly from the half an hour time, that recognition, the time they come to the ER or any hospital, tertiary center, treatment and care is important, because otherwise to treat this is very, very, difficult. So education and prevention strategies and safety precautions are always important. I think sir will take some time, and we end the session. Thank you, Annapurna and Dr. Malay. Thank you so much, and we end the session. Yeah.
Thank you, ma'am.